Hi all, welcome back to our live series and final lab for the Community Health Nursing second for especially 7th semester students. I am Swarnashri and this is Harshita. Ma'am, we are going to conduct togetherly the live which is related to the Community Health Nursing part 2 for our excited examination for tomorrow that we are going to study today. Okay, so in this particular live, we are going to discuss about the syllabus review. Okay, and next one ma'am will going to tell about the important questions. The next we are going to discuss mainly about the lot of confusions which is related to the answer booklet. Okay, so that we are going to give the clarity. The next thing final we are going to tell about the how to tackle the examination with the strategies of writing the answers. Okay, so that we are going to conclude the session. So before going to watch this, completely watch the video because you will get the important questions must and should you will get tomorrow. Okay, so we will start the classes. Okay, so the total number of units start ma'am.
Let's start the session now. So hope this session will be very useful for your tomorrow's exam, and very all the best to everyone. So let's begin this. So we have around 11 units in our community health nursing 2. So you already aware of this and you already studied. So let's begin with unit number 1, that is management of common conditions and emergencies, including first aid. So in this unit, obviously you are going to study about the common diseases and disorders which we are facing in our community, and also the emergencies, and for those emergencies what are the first aids we have to give. So in this unit the very important topics or the very important questions is the first aid. Most commonly and repeated questions are first aid to the burns, first aid to the poison patients, and first aid to the hypoglycemia, first aid to the minor injuries, and first aid to the fractures. And also we can include this heat stroke and snake bite. So these are the very important topics, the very important questions which it's covered in this particular unit. And also we can go with the common conditions like jaundice we can see, cardiovascular disorders we can see, and respiratory conditions we can see, and also jaundice. So these are the expected or the very important questions from this unit number 1, that is management of common disorders or conditions. So we can go through with this points what and all we have written on this board. So there are first aid to burns, hypoglycemia, jaundice, respiratory conditions, heat stroke, then snake bite. So these are the important questions,
So
or
these
the
are the
expected questions from this unit.
So, ma'am, we know that these are the important topic and concept. Okay, so the question will frame like, so explain about the first aid related to the burn. Okay, so they will be give one patient and they will be going to tell you to provide a first aid related to the burns. So you have to elaborate your answer. Okay, so what is the first and foremost thing we are going to do in the burns? Fluid replacement. Okay, so explain and elaborate that treatment and write it down. Okay, so that is the thing. So that is the major important questions which we can able to expect from this particular unit. First unit. Second one.
The second unit is reproductive, maternal, newborn, reproductive, maternal, newborn, child and adolescent health. Child and adolescent health. So here the most expected questions from this unit is antenatal care. So in this antenatal care, very important things you should know: what is this antenatal care, what are the objectives of antenatal care, then what are the antenatal exercises, antenatal visits for the pregnant woman, then the nutrition and iron and folic acid supplementation, immunization of the antenatal mother. So everything about this antenatal care from the beginning, from the intro to this, all the immunizations, exercises, everything you have to include in this particular question. So next topic is postpartum care, obviously. So if the antenatal care is included in this, definitely we have to focus on the postnatal mothers. So about their immunization, neonatal immunization, we have to focus. Then we have to focus on the postnatal mother health and the exercises of postnatal mother. So this will be included in this particular unit. And next is breastfeeding.
Yeah, continue.
Breastfeeding, safe motherhood, Immunization schedule is very, very important in
In
this
this
unit.
breastfeeding, you have to know about the advantages, and one more thing, we have to know about the
Techniques of breastfeeding, then benefits for the mother and benefits for the baby.
Regarding the
So this
colostrum and all,
it's
you have
very
to know.
important.
Next.
Then in the lactations,
Ah.
lactation is important.
Define
The
lactation.
stages of milk production is very important. Next, so in this unit we can also expect the high risk pregnancy conditions. So that is also you have to focus high risk pregnancy, like for example eclampsia, pre-eclampsia, gestational diabetic mellitus. So this we can expect in this unit. Then the one more thing is, write down,
Okay.
RMNCH.
RMNCH. Okay.
CH plus A approach. So this is nothing but reproductive, maternal, newborn and child health with adolescent care. So now they have added including this neonate, maternal and reproductive, and with the child care they have added this adolescent care. So in that you have to write down the strategies of this scheme or the program, then interventions of this program you have to add this. That is very important. Then along with this universal immunization schedule is very important.
That
then
is very, very, very much important. Don't forget to study this
universal immunization schedule. That is very important. From the newborn, means from the day of that baby born, from that to up to the pregnancy, means that dosage whatever and all they will give, including pregnancy, you have to write in that immunization schedule. Then take down RBSK full form.
What?
RBSK, Rashtriya Balik Swasth Karyakram. So this is very important. You have to know the full form of this. Sometimes they will be not as the expansion of, means sometimes the questions will be not in the expanded form. They will be asked like what is RBSK and what is RMNCH plus A. So like this only the questions will be coming, and they can even ask that what is universal immunization program, means UIP. They can also ask in this abbreviations form. So you have to be clear with the expansions of particular words. So this will be included in this your unit number 2. And next let's move to the unit number 3, that is demography surveillance.
Unit number 3.
That is demography surveillance and interpretation of data. Demography surveillance and interpretation of data. So here the main thing it is we have to focus on the demography and the vital statistics. So in the vital statistics, the indicators of vital statistics is very, very important. So you already studied this, the mortality rate, morbidity rate, neonatal mortality and morbidity, then maternal mortality and morbidity. So this and all the indicators of vital statistics you should learn this. Then sources of vital statistics is very important. Like for example, the census what they will conduct or the surveys they will conduct. So how they are going to conduct the vital statistics means how they are going to conduct the means how they are going to collect the indicators of this vital statistics. For example, death, birth, or the disease the people are having. So how many populations we have. So all those indicators must be included in this unit. Then about the MCTS, mother and child tracking system. So definitely they'll ask this. This is the most repeated question in your community health nursing. MCTS, mother and child tracking system.
1 second. You speak, ma'am.
It's a mother and child tracking system. The very important question, you have to learn this. Okay. Next is, and they can ask in this form, just MCTS means what? Okay, MCTS full form you should know, that is mother and child tracking system. Next.
1 second, ma'am.
Mother and child tracking system.
So this definitely they are going to ask for expand. Okay, 2 marks we are expecting this one right now,
yes,
ma'am. The next one,
Next is unit number 4, that is population and its control. So the unit number is population and its control.
Population and its control. It is not
Yes.
controlling.
Yeah, in our India it is not at all controlling.
It's okay. You have to study about this one. Population explosion and all will be there, no? So that is the very important concept in this.
Population explosion is a very important question, the most expected question. Then the effects of population explosion, that is also a very important. Then to control this, what are the measures from our government of India they have implemented? That is also very important. You can study that in the family welfare services, or you can also include that particular question, that is a family planning. They can also ask like either it is in the family planning, or they can also ask a family welfare services. Give in detail description about the family welfare services. And in this you have to include definitely the contraception, the contraceptive methods, the methods are which are used to prevent the unwanted pregnancy. That is temporary methods you have to include, and also the permanent methods of contraceptive you have to include. Each method you have to expand. If they ask this for the 5 marks, or we can also expect this for the 15 marks. If they ask the complete expansion,
here one person
we have to
start fastly. We have started dear. I think hope you are watching. And creep one, hi. Have you had coffee and all? Have you studied? Revise 1 or 2 times. The next is that regarding this one, we are expecting the population explosion, family planning. Then in that
contraceptive method. Then we can also expect this MTP Act. MTP Act, Medical Termination of Pregnancy Act, is very important. Then the National Family Welfare Program is important. Either they can ask like family welfare services or National Family Welfare Program. Must and should you study this? Yes, this is very, very important topics. Next unit is occupational health. The unit number 5, it is occupational health. Obviously in this occupational health, the disease and disorders which is caused due to the particular occupation or particular job. Okay, so in this, what are the asserts of occupational occupation? Okay, so that you have to study. Then ESI Act is very important. ESI Act.
ESI Act is very important in this occupational health, as well as the occupational related disorders like silicosis,
then astrobestosis. So these conditions and all you have to focus, and what are the assets or the effects of these conditions, what is this you have to write, because we can expect this for the 2 marks. Define silicosis, like this also they can ask. Then in the ESI Act you have to mainly focus on the benefits, who all are the beneficiaries which is included in this act, and what are the strategies they have used in this act. That is very important, you have to focus on this. Next, the next unit is geriatric healthcare. Unit number 6, it's a geriatric healthcare. So in this geriatric healthcare, so mainly in this particular unit, the role of nurse in the geriatric care, it is very, very important. So if they ask the questions from this unit, you particularly should mention the role of nurse when the geriatric is facing with the common conditions or the common problems which is related to their age related problems. So in that case, what is the role of a nurse? Being a nurse, what kind of support we should give to them? What's our role? So that we should write in this particular unit.
So here Pavitra is asking, ma'am, is there prediction question paper? Yeah, in this only we are going to predict the questions for tomorrow examination. For sure you will get from this concept only. Based on this concept only, you are going to get the questions. Okay, so most of the important questions only we have made, and based on this concept only you are going to get the questions.
Okay. So next in this unit also you have to include national program for health care which is completely related to elderly. Okay, that is also you have to see that, because national programs which is related to this communication or the communicable diseases or non-communicable diseases, it is very important. They definitely they'll ask any one of the program from this national health programs. Okay. Next is unit number 7, that is mental health diseases or the disorders.
1 second.
Our
Next.
unit number 7, it is mental health disease or disorder. So in this mental health disorders or the diseases, which includes dementia, depression, mania, bipolar. So for this and substance abuse. So this is a expected question. Substance abuse, yes, we have to include this. And for this drug de-addiction program, it is very important. The very important question it is. And you have to focus on the National Mental Health Act is different and the program is different. You have to study the both the things. Okay, so National Mental Health Act is different. National Mental Health program is also different, and you also have to study this district mental health program and national mental health program. That is the important topic or the important question
So
from this
one more
particular
thing,
unit.
One more thing, that whenever we are telling about the act or the program, you have to write what is this program. After that, objectives of the program. After that, how it has been evolved. What is the benefit,
Strategies.
beneficiaries, who will be the beneficiaries, strategies. Okay. So in this way, you have to elaborate your answers. Okay.
Then the very important thing is when you are writing the program or the acts, you must specify with the year of when they have implemented, when they have started this particular
Established.
act. Okay, that is very important. You have to add that, and who have started this particular act. That is also very important. You have to be focused. You have to be precise or particular with that year of that implemented acts.
Wherever you are specifying that, then and there itself highlight that with underline. Okay, so don't make that later I can come and underline. Don't do such kind of things. Underline with a black pen only. Okay, no need to use any kind of other color pen. Okay, so hope you guys already know about that.
Okay, so the next unit is unit number 8, health management information system. So here, which is a little bit completely related to our statistics part, what you have studied in the research and statistics. So here you have to study a little bit about the sources of vital statistics, which I already told you in the another unit. And here you have to include the sampling techniques, means how they are going to collect further research, how they are going to collect the samples, what are the sources of collecting the samples. So that and all you have to include in this particular unit. And the record and reporting of this health and management system, it is very important. You have to focus on this particular topic here. Next, unit number
Which one?
9. So management of delivery of community health services. Okay, so the next unit is unit number 9, that is a management of delivery of community health services. This is very important in this particular unit. Definitely they'll ask this PHC and CHS. Just keep it in your mind. So in this unit, the very important topic is organization level of healthcare delivery. Okay, how the healthcare delivery system it is organized in the rural and also in the urban. So the urban healthcare delivery system is completely different from the rural. So both difference you should know, and in this you have to learn about what is community health centers and what is primary healthcare centers. So what are the principles of primary healthcare centers, what are the principles of community health centers, that you should know. Then what are benefits we will be getting from the PHCs and the CHS, what kind of disease treatment they will be giving, either it's a minor or the major, whatever the benefits which
Then
is included
system.
in this you have to know, and sub centers you have to know, and referral clinics you should know. This is how the delivery system of health it goes. So it's very important, you should know this. Okay, then in this unit we can also expect the very important question, that is Ayush.
Yeah, alternative system of medicine. Ayush.
System of medicine. Wait.
So A means?
A stands for Ayurveda. Y it is yoga. U stands for Unani. Then S Siddha.
Homeopathy.
H stands homeopathy. So this is what the alternative system of medicine in our India which we are follow.
So this is very easy and you can remember by study
The
that
word
word.
that
Word
is
itself you
Ayush.
can recall. Okay.
It's just a mnemonic to remember all those words, that is Ayush, Ayurveda, Yoga, Unani, Siddha and homeopathy.
So must and should they will be asked for the 2 marks question. So
Yes.
definitely they will ask this one. Okay.
Okay. Next is unit number 10, that is leadership, supervision and monitoring. The next unit is unit number 10, leadership, supervision and monitoring. So in this unit, so the description, job description of primary health nurse, in that male primary health nurse, female primary health nurse, okay, then multi-purpose health worker or the multi-sectorial health worker, we will call them. So the description of this, their jobs, it's very important. The qualification of the one who has to select it for the PHN, okay, primary health nurse, if they have to select, what is their qualification, what qualification they should have, and what is their job description. So that is very important, you should study that. Then multi-purpose health worker also you have to study. Then MLHPS, okay, MLHPS, that is mid-level healthcare provider.
Providers.
So
Okay.
that is also you have to study.
So in this, whatever the role will come now by the primary nurse as well as the MPHW, okay, multipurpose health worker, then MLHPs. So everything you have to study the roles and responsibilities and expand that, okay. If they are asking MLHPs, don't write it down in the same way, okay. Expand that one and describe the role of them, okay. So that is very, very important. MLHP is, I think we have a 4 to 5 pages of concept, okay.
Yes.
Thoroughly you study that one and go. Lot of programs will they are going to be rendered.
So in this, whatever they are asking, either it's that primary healthcare nurse or the community healthcare nurse or the MLHPs or MPHM, MPHW. So you should write that job description. That is very, very important. It's nothing but role and responsibilities. Okay, you can also mention that it's a role and responsibilities or duties. Either you can also write job description. That is very important. You have to be specified with this.
One more important is ASHA. So
Yes.
expand ASHA, accredited social health
Activist.
activist. Okay, don't write artist. Most of the students have written this artist. So this is the thing you have to confirm. This is activist. Okay, so that you write it down for the expansion. 2 marks they will ask, and roles and responsibility of them also they will be asked.
Okay, and in this unit also we can expect the records and reports. The maintenance of documentation is very important. And what are the types of records and reports? How the being a nurse, how we should maintain the records and reports, that you have to be mentioned in this. And one more thing, it is EMR. EMR.
What is this?
That is electronic medical record. Okay, this also you have to study. This is one of the important topic, that is EMR, electronic medical record.
Instagram.
Total 13 units ಇರೋದು. 11 ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. Okay. 13 minutes ಕಂಡ್ಲೆ ಇರೋದು. Next, unit number
12. Okay.
11. Next, the unit number is 11, disaster management. Disaster management. So in the disaster management, disaster preparedness and emergency preparedness and disaster preparedness cycle, it is very important in this disaster management unit. Disaster or the emergency preparedness, then cycle.
So when it comes to this one, they can ask like explain about the disaster preparedness or emergency preparedness. One question you can expect in the 5 marks, or the next is explain or describe about the disaster cycle. So 2 questions we can expect from this particular unit.
Okay. Next, unit number 12. So the unit number 12 is biomedical waste management. This
Don't be
since from
confused. You already studied these units. That is why we have told that
11
important
units.
units.
Important
Okay. So the
units.
12 is we are going to speak about learn about the biomedical BMW. Okay. So not a car, biomedical waste management.
Yes. So this in this biomedical waste management, obviously since from first year of your nursing, you are studying this particular topic. So this is the very easiest topic for you. Even until your last breath, you can remember this.
Because without you, you can't able to work in the hospital sector or
Yes.
anywhere.
So in this biomedical waste management, the waste segregation, collection, segregation, transportation and management or the treatment of this waste, biomedical waste management, it is very
Color
important. Color code and the categories of this biomedical waste management, it's important. Segregation, collection, segregation, transportation and management. And management means how we are going to collect the separation of this,
segregate according to
how
the
we are
color code.
segregating the biomedical waste which is generated in the hospital. Okay, after that the transportation of that, then treatment. Okay, how they are going to manage this biomedical waste which is generated in the hospital. Okay, next.
So majorly we are going to know about the hospital waste management only. Okay, so for normal waste there is a different criteria for collection, segregation and all, but for hospital waste those are the hazardous waste. Okay, so that is why we have to more consciously we have to segregate, otherwise you will get the fine, you have to pay it. Don't worry about that. So that is why study properly according to the color code wise. Okay.
Okay. Next unit is unit number 13 and this is also you already studied. Okay, health agencies. The last unit it is health agencies. So in this health agencies, obviously we are going to see this international agencies, national agencies and voluntary health agencies. Okay, or voluntary health associations we can see. So in this international agencies, we have WHO, UNICEF, FAO, WHO, UNICEF, UNESCO, FAO. We can expect something like important from this unit. ILO. So when they ask this health agencies, okay, just internationals or the national agencies or either this voluntary agencies or the voluntary organizations. So whatever, either they ask this WHO or the UNESCO, UNICEF, what you have to do means first expand that word, particular word. Okay, after expansion, you should start with the intro where when they have started this international health education, when they have
Agencies.
established. Okay, then what is year you have to mention, and headquarters, where the headquarters of this WHO or the UNESCO it is present, that is you have to be clear with that. Okay, when it comes to the national agencies, we have Indian Red Cross Society, Indian Red Cross, Indian Council for the Children Welfare or the Child Welfare, Tuberculosis Association of India,
TB Association of India.
Next, All India Women's Conference. We have this important topic. All India Women's Conference. So this is the important, and the voluntary.
Voluntary means NGOs and all will be there,
like
no? So
non-governmental organizations you have to write.
So lot of non-governmental organizations, they are going to provide the education during the flood time. Means education also they used to provide for the orphans,
counseling and rehabilitations they'll provide.
And then for especially flood time, disaster time and all, they have to provide lot of money for our nation. Okay, so they who are staying outside of the our country, definitely they will come for the help during the necessary time. So those are the NGOs, non-governmental organizations.
They'll be providing some fund,
but it is not authorized by the government and all. By themselves they will be initiate and they are going to provide the help to the people. Okay.
Yeah, so far we discussed about the important questions which we can expect from the each units. I hope you all understand this, and this is very, very important. If you didn't study, still you have a time. You can sit and study. If you already studied this, give a review of this. Just revise it.
Okay, so far we have discussed all the important things what you have to study in this particular unit. Okay, so now we can discuss the things which is related to exam writing pattern. Okay, so
Pattern
so
of
far
exam writing.
question paper will going to be for how many marks? 75 marks. Okay, 75 marks question paper will be there. So total marks is 75. One second. So that here you can see that the question paper pattern. Okay, so one thing I would like to tell you that don't be worry about the question paper, because first time these people are going to appear for this 15 marks question. 2 questions we are expecting from this particular paper, okay, and the particular subject. So the next thing we have short essay type of questions. So short essay type of questions, around we have the 5 questions. Okay, each question carries 5 marks. So next, short answer type of questions. Okay, 2 marks questions we have hardly 4 questions we have.
Close one.
So 1 marks questions we
It's
have
nothing
that
but
multiple choice
question,
questions.
MCQs.
10 questions we are expecting. 12 questions.
So
Okay.
this is how your exam question papers pattern it is. As you all know this, you have since written from the first semester. So you'll be having 15 marks, 2 questions, it is around 30. Okay, next 5 marks, it's 5 questions. Okay, then 2 marks, 4 questions, and MCQs you will be getting around 12 MCQs. That carries 1 mark. Each question carries 1 mark. Next, when it comes to this 15 marks, so now the booklet has been changed. We'll give the review of this. Okay,
What are the important questions of 7th sem? Yeah, attitude king. That only we are going to give now. Okay, so now you listen to that what is the pattern of question paper. Now we are going to give that questions only. Okay, nursing first sem exam of RGHS, can you help do preparation for the examination? Yes, last live you go and watch. Tomorrow we have the nutrition and dietetics examination, no, and biochemistry. Completely we have given the important questions. Ma'am, first year Rajiv Gandhi College. Important. Already done. Live has been done. You just go and watch it out in the Drista.
first sem.
Yeah, dear, already given. You go and watch it out in the YouTube. Ma'am, you tell the important questions of first semester. Told already. Lot of questions we have told. Screen size not fully covered because we are conducting the same time YouTube live also. Okay, so you can go there also. So one second. PR means I don't know da. Ma'am, yeah, please tell what you. Yeah, we are giving. Wait, just 5 to 10 minutes. We are going to provide all the important questions. So the far sure we are expecting those questions from tomorrow exams. Okay. So this is all about the question paper pattern. Okay. So now you got that question paper pattern. We are going to expect for the 15 marks. What do you want to write for the 15 marks? Now madam will tell about that.
See, previously when you are answering for this 15 marks questions, so there are already mentioned question papers you used to get. Okay, inbuilt question papers. So, but now the question paper or the booklet pattern, it is completely changed. So here we can expect you to write for the 15 marks. Obviously, you used to write for the 5 to 6 pages. So you can also write the 5 to 6 pages of answers for this 15 marks questions. So the better option you have now, you don't have to follow that question number they have given, so we have to follow that same page numbers. So you don't have to worry about it. Why? Because you will be getting a lot of pages when you are writing the multiple choice question. Within a one paper you can write it 12 marks questions answer. Okay, so no need to worry about that pages. You have a lot of pages, you can go through with the 5 to 6 pages. Even if you know better about that, you can go with the 7 or 6.5 pages. That is more than enough. Why? Because the time management during your 3 hours, it is very, very important, because it is too crucial. 3 hours, how it goes, you don't even
Can't
imagine.
Yeah.
Okay, so you have to be very precise about your time management. That is very, very important. Okay, then when you are writing this 15 marks questions, you have to write 5 to 6 pages based on your time and your handwriting speed. That is very, very important. Like how you should cover this 5 to 6 pages. That is very important. Now let's take one question. Okay, so explain in detail about antenatal care. Yes, so they have asked you this question. Okay,
So
first thing is you have to
write a
question number, or the question number 1, that is antenatal care. You have to underline this, because the evaluator, they should know which question you are writing. The heading of that question, it is very important. You should mention that. Okay, antenatal care. So in this antenatal care, you should start with the introduction.
So start with the introduction. Why? Because that too in a point wise form. Okay, introduction means no need to write the story
or the paragraph, that and all, it is not entertained. Okay, so the thing is, what you have to do means, whenever you are writing the points, you should be write it in the, like, use this bullets, or use those points. You can use like this, or you can also use the stars, or you can use the circle points. So like this, better, instead of writing in the paragraph, you write this. Okay, around one paragraph you have studied. Okay, in that, make 2 or 3 points, like that you should write. Okay, so for that is very easy for the evaluator, one who is evaluating your paper, instead of writing it in the para, and they'll be feel like this is a story they have written. And so instead of that, just try to impress them. And the very important thing is, don't keep this points underlining at last. Okay, when you written the point, you know, the very important thing is you should underline it. That's all. Okay, that is very, very important. Next,
one more thing, ma'am. For introduction, people were going to write 1 page. Is that needed really?
No, really don't waste your page here. Okay, for introduction, around 4 to 5. It's 3 to 4, it is enough. Okay, 3 to 4 points is more than enough for this giving a intro of particular question. Okay, try to give it, or try to finish it within the 4 points. 4 points. Okay, not a paragraph, 4 points. It covers around your, because you will be having a big lines. The space between the one to another line, it is more in your answer sheets. You know that very well. So you should be finished within the, like, around 10 to 11 lines. That is more than enough, because in that page only you should cover the definition.
Hardly 3 to 4 points or 5 points. Maximum 5 you keep. Okay,
that's all.
If you are writing 1 page, your time will destroy over there only.
Because the introduction is not more important, just you're telling about what is this, that's all. Okay, not the description of that particular topic. Next thing is, you should write the definition. Okay, after that you can go with the objectives. If you have space in the first page, you can include the objectives of antenatal care in that first page, or else you can start with the second page. Why? Because when they ask this definition, always keep it in your mind, you should write 2 or 3 definitions. Okay, always you should keep what? 2 or 3 definitions you have to write. Next, objectives of antenatal care. See, whenever you are writing kind of types, causes, or the signs and symptoms, or the objectives, or the components, try to use kind of flow charts or small diagrams, or that what is we call as, in the sense, schematic presentation. So you can use the schematic presentations. For example, you are going to write this objectives. Okay,
so you can see over here. See,
you can make a schematic presentation like this, and you can write the important things. For
Objectives.
example, objectives of antenatal care. What is the more important thing, or what is the main objective of antenatal care is preventing high risk pregnancies and promote maternal health and promote child care. Okay, so these are like objectives, main objectives we can write. So one point you write it and just
do the
draw
highlightation
like this.
So
okay, and whenever you are writing it in the presentation or the schematic presentation, don't look like it's just you are covering the paper. Okay, you should attract the individual, sorry, you should attract the evaluator. When they are seeing you, they have like, they don't think that you have written it only to cover the pages. Okay, instead of that, you have elaborated this answer. They should feel like that. Okay, just to cover the pages, you are drawing this schematic presentation. Here somewhere else you are writing one point, somewhere else you are writing another point. Not like that. Okay, so when you are writing the schematic presentation, that must attract the evaluator, and as well as it should be in a structured way. It should not be like that the evaluator needs to come and know that you are doing the page filling. No, it is not like that. Okay, so whatever the schematic representation you can use, it should be in a structured way. Okay, that is very important. This is all about elaborating the answer, especially for 10 marks and 5 marks. We are not supposed to tell you to write this for 2 marks questions. Who will write a 2 marks question one page? Nobody will write. Okay, so in the 2 marks also, most of the time types, objectives, in community we are expecting the same thing only. We are expecting components they will ask. So in that cases, what you have to do means, for example, okay, just they have asked this cycle of disaster in the 2 marks. What you will do, directly you will draw the cycle. Okay, and you will come. Don't do this mistake. Okay, so because in the 2 marks, the evaluator is always gives 2 marks for you complete. Okay, when you are writing 10 pages for your 15 marks answer, you will not get 10 out of 10, or you will not get 15 out of 15, or you will not get 5 out of 5. But when it comes to the short answers, we can expect the evaluator, they will be giving 2 out of 2 for you. So that is very important. Okay, so when you are writing the 2 marks answer, you must be specified. When you are writing, just I gave an example that they have asked you to write the disaster cycle. So before starting that, writing that cycle, you write something about what is disaster. Okay, what is the disaster preparedness? After that, you come to the cycle and explain what are the phases of this cycle. That is very important. Yes, okay, in the 2 marks you have to elaborate it and write. Don't they ask the definition that of much only this if you are writing postnatal care. Just you will write 2 lines. What is postnatal care? That is not entertain. Okay, you have to write the complete description of that particular topic. At least if you don't know that, for example, they have asked you this disaster cycle. Instead of, if you don't know that cycle, try to write related the disaster. If you know the definition of this disaster preparedness or disaster, you write this. At least instead of getting 2 marks, you will be getting 1 mark or half mark or 1.5 mark. That is very important. Even the 1 mark also, it is very important for you to get pass in the exam. So you should not leave any questions. Keep it in your mind. If you don't know the particular answer for that, you should go with the related answers sometimes. So why? Because you know why we are telling means most of the students were going to be fail due to the lack of knowledge which they are not having regarding the answer writing presentation skills. Okay, so improve that one. Definitely you can get it pass in your examination. So that is why you have to improve the way of your writing presentation of your answer. That is very important. Then keep your answer sheets very clean. Okay, like don't maintain like that. Don't scratch your answer sheets, or don't cut it, like don't do all those unnecessary things in that answer sheet, answer booklet. Okay, when you're writing, if that point is not correct, you felt that it is not correct, just this is enough. Some of the students, they'll be like doing like this. Yes. It's most of the students, you people are going to do that things. Okay. That will make sure your paper will be very messed off. Pissed off. It will look like very odd. Okay. Better you just don't know this. One strike. Just one strike. One strike is enough. Okay. So like this, you have to maintain your cleanliness of your exam paper. That is also very
And
important.
most
Don't
of the
forget
people
to
will do
underline
that.
the important points.
First paper will be look very attractive, very nicely. Last page was like hangama they have created.
That
So
is a
that
very
things you should
important thing.
not do in the examination.
Why it happens like this means first initially you'll be having a patience and you will be having time. When it comes to the last page or the last question, you will lost your patience, you lost your time. So for that, what is the solution in the sense you should maintain or you should manage your time. That is very important. See, you have to write 12 MCQs. Just think, you are reading one question. Okay, for that, how many minutes you want? Just 1 minute. Within a 12 minutes, you should cover this MCQs. Okay, you take 15 minutes. Within 15 minutes, you should cover this 1 marks questions. Okay, next, come to this 2 marks questions. You'll be having 4 in the sense. For this, to write and to think, at least, okay, you take 2 minutes.
One question. Per
One question. Okay,
Total
2
8.
minutes. Total 8 minutes.
Minutes.
Otherwise, you take it.
10 minutes.
Sometimes it extends to 10 minutes. Like this, you should manage your time. That is very important.
You should
For
not,
that, you should take one question paper. Do practice of that. You already completed your studies. Now you are doing a revision. This is your revision time. This is your revising time. So in this phase, what you have to do means close your all the books, close your all those materials, whatever you have. So take one question paper, how you can give an answer for this. 3 hours you keep, how you can write the question paper within a 3 hours. That is very, very important, time management. If you are managing the time, easily you can write all the questions. You can attend the all questions.
Okay. Now, so far we have discussed all about the answer writing skills and presentation things. Okay. So now we can move towards the important topic, which is we have to enclose in front of you. That is regarding tomorrow's new booklet. Okay. Ma'am, you all know about that new booklet, no? So people are having lot of confusions and they are keep on asking what is that new booklet rules and all. Please explain it.
Yeah. See, from the university, we will be getting 2 booklets. Okay. For everywhere in the Karnataka, they have got this. One is old booklet and one is new booklet.
Why?
Okay,
Because
don't
they have
get confusions.
introduced.
Don't get confusions. Don't be anxious about that.
Afraid.
Your booklets. Okay. Just a simple changes they have made in that. If you are getting a old booklet, so it is well and good. Okay, as you all know, because you are in the 7th semester, you already written a lot of exams. So you'll be aware of that. If they gave the old booklet, you can go with the page
Same
number
concept.
how they have given. So you can go with that. See, if you are getting a new booklet, that you should check. Okay.
Yeah. That you should check. And one more thing you have to do in that, we so university had implemented part 7. Okay, so part 7 in Roman number V number. So like this it is there. Remaining parts and all you should not touch. Before that, only one thing you have to follow here is that should not go and open the booklet without invigilator's announcement.
Instructions.
Okay, so she or he has to come and give the instruction for you to open the booklet and read carefully wherever the necessary information that have given in the booklet. Just to study it, and after, because they are having 15 minutes of time, why can't you people to give 2 minutes for that? Without doing any mistake, you have to write it down. Okay, so in the part 7, what you're supposed to going to do is that in the new booklet there is no question numbers. Okay, remember, there is no question number. Whether they are given or not, you have to put the question number. Suppose you are writing the question number 1, you have to write down first question number 1. Okay, so start to answer. Okay, start to answer for introduction. Okay, along whatever we have explained right now, no? So the madam explained, so that one you have to follow it. Okay, after next you may go to the second question. Same thing, question number 2 you have to put and start to write. The part of the 7th, what you want to do is first you have to write the question number. Next, suddenly you have to know that first question 1 to how many pages you have written.
written.
Suppose you are written up to first to 6, you have to write 1 to 6 first question. Next to the question number. Okay.
Question number 1.
And
Then in that you have written
2 columns
from
will be there.
page 1 to page 6.
6. Okay. So here also you can put a hyphen. No need to write the 2 and all. So but you may have the question number 1 column, page number 1 column. Okay. 2 columns will be there. There you have to fill the things like this. Okay. So now you got the complete
If you
idea.
get the new booklet, this pattern you have to follow. If you didn't get it's a old booklet, obviously your invigilator will be giving instructions before giving your question paper. So you will be having 15 minutes of your time to fill your booklet. So in that time, be aware you have to read the guidelines which is given in the booklet. Okay, that is very important.
Okay, so this is the thing regarding the part 7. Okay, so the only that, but if you don't know, please ask your invigilator. No need to write anything in the part 5, 6 and the 7 also. Okay, don't do any hangama, and bulletin also while bubbling and all should not put on dot like this, like that and all should not do.
That OMR you should shade it properly.
Yeah. You are very aware of those things. Don't do such mistake because it will lag your time and all over there. So now we can give the important questions from the community health nursing. The first question, 1 second. 1 second, we will tell that first question. Camera ನೋಡ್ಕೊಂಡು ಹೇಳು. Focus ಆಗಿ. ಒಂದು question ನಾನೊಂದು ನೀನೊಂದು ಈ ಥರ. Okay. So we are going to tell you the very important questions tomorrow we are going to expecting. Okay, so the first question is that explain the organization and the functions of primary care system in India. Okay, so that is the first question, important question which we can expect for the tomorrow examination. Either it may be 5 marks or it may be for the 10 marks question.
Okay, the second question is describe the National Health Mission, its objectives, components and role of the community health nurse. So as we all discussed about this, the role of community health nurse, it is very important. So we can also expect this National Health Mission.
Okay,
question.
So wherever you are getting the questions, okay, regarding any program, you have to mention at the last of the question is that role of the community health nurse, educator. Okay, so lot of roles she has to she will follow, so that you have to roles and responsibility enumerate there. Okay, the next one is that discuss the reproductive, maternal, newborn, child and adolescent health. Okay, so that madam already told, no, RMNCH plus A. Okay,
adolescent.
So yeah, so according to this and their strategy, definitely you will get this question. Okay, so study this one.
Okay, next question is explain the National Tuberculosis Elimination Program and the nurses role. Okay. This is very important. They can also ask NTEP. Okay, National Tuberculosis Eradication or the Elimination Program. Okay,
next one, discuss the National AIDS Control Program and the prevention of the AIDS and HIV and along with the role of nurse in community health nurse. Okay, so you have to include that. Next question is explain disaster management with the role of nurse during a different phases of that disaster. As we also we said that disaster cycle. So during that cycles of the disaster, what is the role of nurse that you have to write. The next one is explain the school health services and responsibility of the community health nurse. Okay, lot of school health services we have seen that midday meals program. Okay, so that and all. Okay, health checkup we need to conduct for the school health childrens to ensure their health and all. Okay, so adolescent girls we used to conduct lot of programs, health education awareness programs regarding their menarche and all. Okay, so those are the things you have to implement and the objectives, strategies, components. Okay, based on these factors you have to explain the answer for this. Okay, so once again I will repeat that explain the school health services and responsibilities of the community health nurse. Okay, next one.
Next question is describe occupational health services and role of occupational health nurse. Okay, here also the role of nurse, everywhere of these questions you are getting a role of nurse. That is very important. Keep it in your mind. Okay.
Next
Next.
question, discuss the environmental sanitation and methods of safe waste disposal. Okay, instead of this, you are going to expect the questions which is related to the biomedical waste management. Okay, so this is part 1, like it may be, or you study this also. Along with that, biomedical waste management and this treatment and this procedure and color coding,
Segregation.
collection, segregation, transportation, each and everything is very important. Next
Okay.
one.
Next question is explain health planning in India and the role of various health agencies. Okay, the last unit, health agencies in the prevention of health. In the promotion of health and the prevention of disease. What is the role of healthcare agencies? That is very important. Either it is a national or the international or the NGOs, voluntary organizations.
So
that
if you
have
have
to
any
study.
doubt, you can comment it down or you can chat with us in the Instagram. We are doing live in the Instagram also. You can join through that. And one more thing, in the short essay form of questions, we are expecting that Village Health Sanitation and Nutrition Committee, VHSNC. Okay, so this is one of the important, and we are expecting that accreditation social health activist. Okay, so that
ASHA.
they will ask ASHA, expand ASHA, 2 marks or 5 marks, the role of ASHA and Anganwadi
Description.
services. ICDS program is there, no, under that Anganwadi workers will come. What are the role of Anganwadi workers, and the Anganwadi will going to provide what kind of services? Okay, so that you have to elaborate. The next one,
health education methods, then biomedical waste management we can also expect, and national immunization schedule. It is very important. Then for the 2 marks you have to study this cold chain and the vaccine carrier. Okay,
and next one is family planning methods. Okay, permanent and temporary methods will be there, no, must and should you study and write it down in the classification form. Okay, so use the flow charts and write it down, that one. Next one, national program for prevention and control of cancer, diabetes, cardiovascular diseases and stroke. Okay, so national programs will be there, no, in that
for non-communicable diseases that
then,
you have to study.
Yeah. Next one, health indicators, home visit, geriatric healthcare, adolescent health program, and international organization, WHO, UNICEF. Okay, whatever we have explained, no, all those things. Okay, now the next short answer type of questions are like
2 marks.
define primary healthcare, list the principles of the primary healthcare, and the team also they used to ask, no,
Yes.
so many times. The next one is expand NHM, ASHA, ANM, PHC, CHC, VHS, NC, RBSK, RKSK, and NTEP. Write it down. Take a book and write it down. Definitely you will get the
1 or 2 expansion of this
2 marks. You will
programs.
get that one. Define disaster and mention the 4 methods of health education. List the levels of prevention. Occupational health. Define occupational health. Mention 4 functions of the PHC. List 4 family planning methods. Define epidemiology. Okay, so these are the very important questions which we have already discussed among the unit revision. Okay, so review what we have done. No, there we have got discussed about this. That is
same
the
questions,
yeah, same
important.
questions you are going to get for the tomorrow. Must and should these questions only will come. Okay, so hope you guys are clear with everything. If you have any doubt, you can chat with us, or else if you really not knowing about the part 7, kindly, my dear student, wait for a while. Okay, so after that we will see in the next live for the next upcoming examination. Thank you so much. Thank you, ma'am.
Thank you.